Welcome back to Cognitive Processes. In this lecture, I'm going to talk about working memory. So as you know from the last lecture, I talked about attention and how we pay attention to certain things and then discard other information in our environment. Now we're going to talk about when you pay attention to something, how do you move that into working memory and then maybe eventually move it into long-term memory. So this lecture is about forming and using new memory traces. So a little bit of terminology to begin. There's a couple new words that we need to introduce. The first term to introduce is the idea of retrieval. Retrieval is the process of calling to mind previously stored information. So you'll often hear that a lot in this course about retrieving information or context of retrieval, things like that. So be familiar with that term. Another term that you'll see a lot is encoding. And encoding occurs when information is first translated into a form that other cognitive processes can use. So when we're encoding information, we're putting it in a form so that we can maybe put it into long-term memory or do something like that. The information that is encoded is called a memory trace. So this form of information is called a memory trace. We'll talk about that. And then the memory trace is held in storage. Think about putting it in a place where you can hold it and then later retrieving it because you might need it. So we probably put things in storage that we never use, kind of like we put things in our house in our basement and we never use it. But we also put it in the basement because we might use it. You never know, right? And I'm sure you've had this experience with memory. You thought you had forgotten something for sure, and then something popped up, or you saw a person you hadn't seen in many years or even decades, and then suddenly all these memories come flooding back that you didn't even know you still had. So it's really interesting about how much we can store and maybe later retrieve if the conditions are correct for that. And when we say we cannot retrieve something, we say that forgetting has occurred. Okay, so why do we believe that there might be different memory systems? Well, a lot of research is suggesting, and we'll talk about this, is that there's probably different components or models in memory. So you probably have seen this before, maybe in another course, but this is the modal model of memory. And the idea is that information comes in that we pay attention to. And some of it comes into sensory memory, some of it from sensory memory gets moved into short-term memory, not everything, and we'll talk about that. And then things that are in short-term memory, some of that will move into long-term memory. And so we'll talk about each of these components, focusing initially on sensory memory and short-term memory. Okay, so how do we know that we don't move everything in long-term memory? Well, you can do studies, of course. And so sometimes cognitive psychologists like to do studies where they just give people lists of words, things to remember. So they might give a subject a list of words like this that are just random words like table, candle, maple, subway, pencil, coffee, and you get the idea. Going, through 20 lists of words that aren't really related, not all that difficult, but they give them a list of words to remember, and what they find in these lists of words is a serial position effect. In other words, the items that came early in the list, like table, pencil, those words are remembered better, but the ones in the middle of the list, a lot of them are forgotten. But then on the flip side, the ones at the end of the list tend to have fairly good memory. So if the last couple of words are letter, turkey, hammer, you are more likely to remember those words. And so that you can see on this graph, there's all the words and where they landed in the list in terms of order, the serial position in the list. And on the y-axis, you see the probability of the correct recall. And so that's where you're showing that the words early in the list, better recall. Words at the end of the list, really great recall. And then the words in the, most of those words in the middle, not very good recall at all. So this is the serial position effect, and we give a label of primacy effect when the words at the beginning of the list are recalled more easily, and then recency effect when the words at the end of the list are recalled more easily. Now, why? Why would this be? Well, primacy effect, those words at the beginning, those get more rehearsal. There's more time to kind of go over those words in your mind and try and remember them. Therefore, those words might actually get into long-term memory, long-term store. Recency is different. Those words might still be in sensory or short-term memory, and because they've been in those recent stores, then you can access them. Okay, so let's talk a little bit more about sensory memory. So, iconic memory is the visual information in raw, uncoded form that we are seeing all around us, all the visual stimuli. And when we think about sensory memory, when we think about this visual information, it is vastly large capacity. Think about all the stimuli. Just look around the room that you're in right now and think about all those stimuli that you are taking in and processing. You can take in so much information, very large capacity, but it fades super quickly. And we actually know that it probably fades within a second of seeing it. So how do we know that? Well, there's a technique in studies that they've done that's called the partial report technique. It's rather clever. The idea is you present a display very briefly that has a lot of information on it. So, for example, you can present a display with all these letters on it, and that display is shown to the subject super quickly and then taken away. Okay, show it on a computer screen, take it away. And then immediately after the display is gone, a tone sounds. That tells the subject which row to report the letters. So the display is gone, but the tone sounds. So if they have a high-pitched tone, like a beep, then they report the top row. If it's a medium pitched tone, beep. Then they report the middle row, and if it's a really low pitched tone, like beep, then you do the bottom row. Okay, and what we find is that it's very easy. The subjects have good performance as long as the tone is presented within 1 second of the display going off. But if you wait even like 5 seconds, then they lose it. They just don't know. So, if you have display within a second, tone, then they can report all the letters in the row where the tone was indicating, high, medium, and low. But if it's more than a second, then it's quickly lost. So we know that the iconic memory is very brief. What about short-term memory? Well, we know from so many different studies, and you probably have this personal experience too, that the capacity of short-term memory is probably about 7 plus or minus 2 chunks of information, like a phone number. If someone tells you a phone number, like here's the phone number of the pizza place, you can hold that in mind and kind of rehearse it a little bit in short-term memory. And if someone gives you 7 things, like 7 digits for a phone number, can you do it? Yes. But if you get more than 9 or, then you're really having trouble remembering the information unless you chunk it. Like, so for example, you can combine numbers, instead of the number being the last 4 digits of the phone number 8263, you might say 8263, and that turns it into 2 chunks, right? The coding of short-term memory they've found in a variety of different studies is acoustic. In other words, what it means is you're like hearing it, and then things that sound alike are easily confused. So it's easier to confuse the letters G and P because when you hear G and P, you think about it, they sound very much alike. But you wouldn't confuse R and P because they sound very different. So that's why we think that it's acoustic. You're rehearsing it. And you probably have this experience if you're trying to remember something briefly like a phone number, you're probably internally talking to yourself to rehearse. Now, how long can you hold on to it? Unless you do something really amazing with the information to really try and move it into long-term memory, it's about 20 seconds. About 20 seconds, okay? So the iconic memory, the sensory memory is about 1 second, the short-term memory is about 20 seconds. So there are all kinds of techniques to look at this information and how we can hold on to information. And the Brown-Peterson task is a really interesting one where they present subjects with 3 consonant trigrams, like just 3 letters, B, K, G, for example. And they ask the participant to remember this information, but then they give them another task to do. For example, they might ask the participant to count backwards by 3s. So start at 100 and start counting backwards. 197, do that counting. And within 3 seconds of counting, they can still get the 80% of the time, get those three letters. But if they are counting about 18 seconds, most of it's lost. Maybe they get 7% of the letters that they were shown. So the Brown-Peterson task tells you that, that interference really matters, and also the duration of time that you can hold that information in short-term memory. So this leads us to the question, why do we forget things? So the first thing is probably the memory trace itself just a case. We cannot hold everything in our brain, and our brain makes decisions about what's relevant, what's not. Something really important happens to you, the trace will probably stay. If it's really mundane, doesn't really not high relevance to your life, not really interesting, not really amazing, not really anything that grabs your attention, that memory trace probably will decline. And it makes sense. We should forget a lot of things that our brain only has so much capacity. But another thing that is really important in why we forget is that there's interference. So we have things that we are learning, and then other new things interfere with the old learning and things like that. And so that interference, you've probably had this experience. You've probably seen a person you haven't seen in a long time, and their name is not coming to you. So you think about the context of when you learned that person's name. Like, say you met them in the second grade and you don't remember their name, but you start thinking about the second grade and you're trying to come up with their name, kind of come up with their name. And what happens? You remember the names of the other people that were in second grade with you, and those names, you keep saying them, and you're like, no, it's not Sally, it's not Joe, it's this other person, but the name Sally and Joe keeps coming up to you, and that interferes with your ability to pull maybe the name of this other person. And interestingly, if you change to a different task, sometimes it'll just come to you, it'll like pop up once that interference kind of floats away. Really interesting, isn't it? So how do we search? How do we go retrieve from short-term memory? Is it, a serial search? Is it exhaustive? How do we know that it might be this way? So when we search through short-term memory, what studies have shown is that we do it in a serial manner. In other words, we're checking each item in the contents of our short-term memory one at a time. So if it's sitting in short-term memory, we can search through those items in short-term memory one by one. And once the search is initiated, it is exhaustive, meaning we search everything in short-term memory. Short-term memory doesn't hold that much. So it makes sense for us to go through everything that is sitting there in short-term memory, even if we find what we're looking for. Now, how would we know this? Well, let's think about this. There's Sternberg's short-term memory search task, where participants are given a memory set of 1 to 6 letters to learn. A probe is presented, and remember we had this terminology from the last lecture, prime and probe. So if you present something first, we often call it a prime. So the participant is learning a set of 1 to 6 letters. That might be the prime display. And then the probe would be the second thing in the order. The probe letter is presented, and so this letter could be from those first 6 letters or not. So you ask the question to the subject, was this letter in the memory set that we gave you? And then the participant gives an answer, yes or no. So this is exactly the same sort of procedure that I talked about in the attention lecture last. The prime is presented, the probe is presented, and then you ask the subject to do something with the information. Okay, so here are 3 possible results. You could have the memory set size listed on the x-axis here, and 1 through 6. And then on the y-axis, we're plotting the time to search, asking the question if the letter is in the display. Now, if it doesn't matter, if they're not going one by one, if they're just like miraculously pulling all 6 things at once, then your data should look like panel A, right? Whether the letter is there or not there, they just look at the whole display in their mind, and then they're like, yes, no, like as if they're looking at it, okay? The second possibility is if they go one by one, it might look like B or C in this example. B would show that when they're going one by one, if they actually go until they stop with the correct letter, then once they find the correct letter, the white line, the yes line, should be lower than the no line, right? So if you think about it, if they're going letter by letter and then they get to the third lever of the display and it was the match to the probe, then they should stop searching. And so the time to search should be shorter for those conditions than they would be for the no condition where they go through each thing. By contrast, in C, no matter what, whether the letter is there or not there, they would be taking the same amount of time to search. And in that example, going through each letter one by one, whether the letter is there or not, they're still serially going through the entire short-term memory contents. And when you look at the actual data, it matches panel C, which tells you that the subject does go through short-term memory contents letter by letter, item by item, until they've been through all short-term memory contents, and then they make their decision yes or no. Okay, so that's how we kind of figure out, like, this is how it goes back to this question of how do we know that these models are correct? We design these cool little experiments, and then you think about the possible results that you would get that would make sense based on how the brain is working, and then you look at the data and you say, okay, well, it's actually this, which is, I don't know, I think it's rather clever in how they design these experiments. Okay, so a little bit more about working memory. So when you think about working memory, you think about working memory like short-term memory, but it's the active nature of what's going on. It's not just a passive place where you're holding something for, 20 seconds. It's actually an active place where they're doing activity with the information, thinking about that information. And the idea of this is that there's different things that you can do to work with that information that might help you move it into long-term memory, or at least allow you to use that information more effectively. And so there's different components to it. There's like a verbal component that is called the phonological loop. I'll talk about this in more detail in a second. There's a visual spatial sketch pad that's like kind of like having a piece of paper in front of you that you can do a little drawing or have like a visual picture of something. There's an episodic buffer and a central executive. So what are these things that we're using in working memory? So working memory, first of all, emphasizes the active nature of working with information. It's not passive, but it's a center of activity. When you have information given, just like in the task we just talked about, you have a bunch of letters that you're asked to remember. How do you remember that information in that brief moment in time? Can you rehearse it in your mind or out loud? But in your mind, we all do that, right? If I give you a phone number and say, go call the pizza place, here's the number. If you walk over to find your phone, while you're walking over, internally, you probably have a subvocal rehearsal of that information I just gave you. That's your phonological loop. When you talk to yourself internally, when you're doing that, you're using your phonological loop. But you can also look at a phone number and then maybe have a visual sketch of that phone number as you walk to the phone. Or some other reason why you would have a visual sketch. The visual spatial sketch pad allows you to maintain visual material. Maybe you're looking for a particular sweater and then you're scanning the store to look for the color of the sweater, and the picture of the sweater helps you find it. Then there's the central executive, which is directing all this flow of information. Obviously, there's more than one thing happening, so something needs to be coordinating all of this and helping the information flow. And then there's the episodic buffer that integrates information and maybe actually helps it get into long-term storage. We have things in working memory that we just can discard. We don't need it further for the future, but then we have other things we definitely want to store long-term. And so the episodic buffer is helping us perhaps get it into the long-term storage. Now, the interesting thing about studies of working memory is there's really interesting individual differences. So people differ in working memory capacity. Some people have better working memory capacity than others. And then when you look at studies, remember last time we talked about inattentional blindness? Well, people who have higher working memory are less susceptible to inattentional blindness. So that's a kind of interesting finding, isn't it? Where you change the person and or you change the situation, they just don't notice. So the study of the gorilla walking through when people are tossing balls and you're counting the ball tosses, the person with higher working memory is going to see the gorilla. Also, people with higher working memory capacity are less likely to have their attention drawn to a misleading cue in an attention task. They tend to be better at reasoning and decision making. They're less likely to be misled by leading questions in an eyewitness task. We'll talk a lot about eyewitness tasks later in the long-term memory chapter. And they just tend to have better cognitive focus. Interestingly, there are a lot of different studies that suggest that you can improve your working memory capacity. So, if you do a lot of working memory tasks, you can improve your working memory capacity. So it's not totally fixed and you can change it and make it better. So if you want to be better at paying attention and having better working memory, you can work at it. And as a college student, you're going to do that naturally, because you're constantly learning large volumes of information and trying to integrate it. And the more you do that kind of work, your working memory capacity will improve. And so it's just really interesting. I think it's an interesting line of research, these individual differences. So how do we know we can train working memory? Well, this goes back to research even from the 1970s, where Chase and Simon did research studies with chess players, and they asked them to memorize chess pieces. And they asked them to memorize chess pieces on a real game where the pieces were in positions that would make sense for a real game. They would put them in a position and then ask them to memorize the position for 5 seconds and then take it away. And what they found is that when the pieces were correctly placed on the board, the master chess players were so much better at recalling how many pieces were in the right position. They were actually better able to reproduce the actual game. But if you just put those pieces on the board in random locations, then there was no advantage for the master's performance. The master player just had like beginner level performance. And so, thinking about this in the real world, when you get a deep expertise in any sort of area, you're going to have expansion in your ability to have working memory capacity, be stronger in your area of expertise. And it tells you there's nothing specifically special about a master chess player, but they do have deep domain expertise in playing chess and where those chess pieces go. So thinking forward of how this will eventually get into long-term memory, think about the modal model of information processing. You have these separate systems, but they're definitely working together, right? So information comes in, it goes into that sensory store. Remember, that sensory memory lasts maybe a second. Then it moves into short-term memory, and maybe we keep it about 20 seconds. You can keep it maybe a little longer if you have maintenance via rehearsal processes, like talking to yourself internally using the phonological loop or something like that. But a lot of this stuff is just lost. But if it's not lost, maybe it gets moved into long-term memory. And then it is a trace in long-term memory that you can retrieve back into short-term memory later when you need it. So the idea is that there's these separate systems, but they're very connected and working well together. Now, how do we know we have different kinds of separate systems? Part of it is from neurological studies of memory. A lot of you know about HM, where HM had surgical removal of most of his hippocampus, amygdala, and other temporal lobe areas because of terrible epilepsy. And once the surgery was done, he could not transfer new memories to long-term memory. So he could remember information from years before the operation, but if you gave him new information, he couldn't transfer that new information into long-term memory. And so the HM case and other neurological cases that are similar are evidence to support the distinction between long-term memory and short-term memory. It's not just a theoretical cognitive construct. There's probably a neurological mapping of short-term memory and long-term memory systems. And it's not just HM. We've seen lots of patients that have had, problems with long-term memory or problems with short-term memory, that are separate problems based on where damage is from, a surgery, from a tumor, from a stroke, all kinds of things that can happen to the brain. I linked this video of Dr. Brenda Milner in the PowerPoint slides. And if you go into the course slides and just click on the link, you can see the YouTube video. She's just this really fascinating person who worked extensively with HM. And she talks a lot about her work as a British Canadian neuropsychologist with HM and, all the different stories she had of working with him. I think that she provides some really nuanced detail of what it was like to work with him. And it's kind of fascinating. She was born in 1918 and she is still alive and living in Montreal today. So I encourage you to take the time to watch the video. I think it provides some really nice detail about what it's like to work with a patient, also what it's like to do neuropsychological work. I personally found it very rewarding to work with patient populations. I think of across my whole career, working with patient populations that have damage in different parts of their brain made me such a better cognitive psychologist. I just thought differently about the topic fully. So I would encourage you to do a little bit of a deep dive and watch that video. And we know from other neurological work that, for example, like PET scan studies, that if you are looking at different patterns of activation and you see that for different memory tasks, then it suggests that there's some localization of function. And it does support this Baddeley's view of separate components of working memory. So the left frontal lobe, the left parietal lobe is really important for verbal memory, phonological loop, whereas the spatial memory, the visual spatial sketch pad, that's more right parietal, right temporal, right frontal. So this idea of Baddeley's working memory model isn't just like cognitive psychologists came up with it and they ran a couple studies and gathered some data that suggests that it might work this way. Like there's actually neurological work that is supporting these models. Okay, so to review what I talked about in this lecture, memory is an active process that involves encoding information, storing it, and then retrieving it from memory. The modal approach divides memory into sensory memory, lasts, maybe a second, short-term memory, maybe 20 seconds, and then long-term memory, which might be for the rest of your life, you can retrieve that information. Short-term memory can hold about 7 pieces of information for about 20 seconds without rehearsal. The code in short-term memory does appear to be acoustic because you confuse things that sound the same, but not confuse things that sound very different. Searching short-term memory is a serial, exhaustive process. We showed that in the data. And then the new conception of short-term memory is working memory, which emphasizes the real active nature of short-term memory, where you have these different components like the visual spatial sketch pad and the phonological loop, the episodic buffer, and the central executive. And all of those components allow you to work on the information, use it in the short term, but also maybe eventually move it into long-term memory, which is, maybe going to be there forever. All right. Thanks for watching.